Emergency contraception. You may know it as the morning after pill. Now, this is the pill that women take to prevent pregnancy after having unprotected sexual intercourse or after a failed family planning method. Now, the question today is, can it affect your fertility? You may have heard stories of people say that you should not take them very frequently, and if you do, you may have problems conceiving in future. As a matter of fact, they say that you should not take more than 2 in a year. Now, how true is this? Join me as we discuss emergency contraception. Hello guys, welcome to the fertility series with Dr. Raisha, and here we talk about fertility, women's health and everything in between. Now, today we are talking about emergency contraception. Emergency contraception is used to prevent pregnancy. And there are some specific cases where you should take emergency contraception. And these are: number 1, if you had unprotected sexual intercourse. Actually, that is why it is known as the morning after pill. The morning after. You get it? Another thing is that if you have a failed family planning method, you are using the condom as your family planning method and it breaks, it bursts, or it is not used properly, then you should use emergency contraception. Other people use the withdrawal as their method of family planning, and so it can fail, and hence you should use emergency contraception. Another thing is that people use different methods of family planning. People use the combined oral contraceptive pills such as Femiplan, Microgynon, Yasmin. If you miss or you forget 3 or more pills, that is for 3 or more days, then you should take emergency contraception. Other people use the progestin only pills. Now, if you forget to take a pill by 3 hours, 3, then you should take emergency contraception. You are using the depot, that is the 3 months injection, and you forget it by 4 weeks, that is 1 month. You should use emergency contraception. Another case in which you should use emergency contraception, if you have miscalculation. Other people use the fertility awareness method as their method of family planning. They calculate their safe days, their fertile days, so they know when they are safe. This method actually is not very accurate, and we do not recommend you using it as your only family planning method. But in case you are using it and you miscalculate your days, and you notice that I miscalculated my days, then you should use emergency contraception. We have different types of emergency contraception. We have the most common one, that is the Plan B, the Post-Coital, 2 different types that we have. And now for this method of contraception, usually it comes in either 1 pill or 2 pills. The 1 pill contains a dosage of 1.5 milligrams. And if you see that it has a dosage of 1.5 milligrams, that means that you should take just the 1 tablet once, and that is all. But most times it comes as 2 tablets containing 0.75 milligrams and the other tablet 0.75 milligrams. Now you should take 1 tablet and then you should take the other tablet 12 hours after you have taken that first tablet. Another method is the intrauterine device. Now this is the IUD that is inserted inside your uterus, and for the IUD it should be inserted within 5 days of having unprotected sexual intercourse. Another method that we have is that maybe you do not have the IUD, maybe you cannot access the Plan B, then you can use these combined oral contraceptive pills. And how these are used is that you take 4 tablets and then you take 4 tablets after 12 hours. And that is how it is used. Now, for the emergency contraception, especially now the Plan B, it should be taken within 5 days of having unprotected sexual intercourse. But the earlier the better. Actually, 5 days is very late. If you are able to take it within 24 hours, within 48 hours, the earlier the better. Another thing is that they prevent pregnancy by preventing ovulation. They cannot stop an ongoing pregnancy. If you are already pregnant, they cannot help you. and they will not terminate pregnancy. If you are already pregnant and you take them, they will not terminate pregnancy. The morning after pill is associated with nausea and vomiting. And so, if you vomit within 2 hours of taking this drug, you should repeat the dose. We talked about emergency contraception and fertility. It is good to note that if you take these pills as recommended, they do not harm future pregnancy. Actually, they do not delay pregnancy. But we have some women who really love these drugs. They actually use them as their main method of family planning. Remember, emergency contraception should not be used as a family planning method. Actually, we could have women who even take 5 tablets in a week. 5 tablets in a week, that is 20 tablets in a month. And so you can imagine this much consumption. I want you to note that for this family plan, these are the family planning pills that we take. We have levonorgestrel of 0.15 milligrams. But for the morning after pill, it has 1.5 milligrams. So you can see it has a very high dosage of this hormone. And so frequent use of this actually leads to hormonal imbalances, menstrual irregularities, and this could affect fertility. Actually, frequent use of this emergency contraception is not recommended in women with hypertension, heart diseases, women who have just delivered, women who are breastfeeding, women with breast cancer, or women with clots or are at a high risk of getting blood clots. And so it is very important to note that emergency contraception is not a method of family planning, and it is recommended that you get a method of family planning that you will be using and avoid using emergency contraception regularly. I really hope that I have answered your question. You know how to use emergency contraception, the types of emergency contraception, and how it can affect your fertility. My dear, if you like this video, why don't you give it a thumbs up? And if you have not subscribed, please subscribe and hit the notification down below.